Welcome back to the stretcher. This is cervical number 3, and I'm your host, Jesse Sawyer, nationally recognized inclusive fitness trainer, silver sneaker flex instructor, and you can find out more about me by visiting my website at www.jessesawyer.com. Now, if you've had the moment or the time to take the first cervical or the second cervical exercise class with me through this format, I'm going to be adding to that third exercise format in the cervical region, where we're going to really focus on the neck and the shoulders and trying to take away not only the pain, the discomfort, any type of tension, any type of tone, and then of course any type of strength or muscular skeletal changes that occur over time, because they do. And those are the things that we want to cover when we go over the cervical region. Now, if you remember from last time, I was talking about the cervical neck, and I was talking about the region and how many vertebrae are there. Now, typically, some people would say 1 to 8, some would take it 1 to 7. There are really 1 to 7 vertebrae in the cervical region. So when I say 1 to 7, it is a C1 to a C7. So you have 7 of them. However, you do have 8 cervical nerves, and that 8th cervical nerve that is at the tip of the neck or at the bottom base before you get to that first thoracic vertebrae, that affects your hand movement, the pinky side and the forearm side of movement. So that's why some individuals would say that there are 8 different cervical vertebrae. In fact, there are not. There are 7, and then you have 8 cervical nerves. So there you have it in regards to that maybe Jeopardy question at some point in time for you, just so that you're kind of aware. Now, before we get started, there are a few things that I do need to cover besides that information, and that's just like a little teaser to get you prepared and get you ready as we get to the stretching aspect of this. So now, you know who's back. It's me in this new form outside with the glasses, with the sun. It's cold outside, but we're bringing some warm fun with these stretches today and just loosen up and take away some of that bounding and tightness and weakening of those back muscles and the tightness of the anterior aspect and the weakness of the anterior part of the shoulders as well. So a few things. One, if you have any lightheadedness, pain, dizziness, discomfort, or fatigue while you're taking this class with me, please hit the pause button and come back a little bit later. Now, Thunctified Maniacs worldwide and across the globe, you Silver Sneaker members, you YouTube subscribers, you Facebook live streamers, a little different. I have to review what we like to call is the Stretcher 5, and that is number 1, that virtual liability. So you should always consider speaking to a physician before you begin any exercise program. By taking this exercise with me, you assume all dangers, hazards, risks of such participation. The exercise is demonstrated by the instructor, and then the online class can be demanding. If you're unable to safely perform these exercises, again, please modify them or choose a different set of exercises. Now, number 2, remember, I can't see you. Even with these fancy, goggles, glasses, whatever you want to call them, specs, I still can't see you, all right? Now, you can see me, and hopefully I'm looking good on the screen, but I can't see you. And the other thing is, I can't hear you. So if you can't hear me, you need to turn the knob up. If you got one of them old phones, I don't even know if they have knobs, but you hit the button and turn the volume up so that you can hear me. Or hit your Comcast, get the YouTube up, or Xfinity, whatever you might use. Streaming, go ahead. This is free. All you need to do is subscribe to my channel. But turn the volume up if you can't hear me. I can't hear you, so I need you to pay attention to form, those mechanics, and the posture, and all those exercises that I do go through and walk you through so that you can mirror the exact same position so that you're not overstraining, you're not having pain, you're not having discomfort. We're trying to take that away. We're not trying to add on to any pain or discomfort that you might be experiencing at the moment. That's why you tuned in, so we want to try to take that away. So hopefully I give you a laugh along the way and that you enjoy this episode, the Cervical 3. Now, the other thing, as we go through this, and if you're sitting in the chair or if you're in a car like I am right now, you want to definitely sit up on the edge of that chair or in a comfortable position. If you're in the seat at home, you want to sit on the edge of the chair. You want to tuck your belly. You want to tuck your tailbone. You want your chest out. You want your shoulders up, back, and down. You want those ears over those shoulders, and you want to elongate that spine, because the cervical part of the neck is part of the spine. It's connected to it. So you want to still elongate that, and you want to relax those shoulders. So that's really tough for me because I'm in this seated position. I'm in this elongated landscape position as well. So we want to definitely make sure that we can provide those exercises in that screen so that you can see exactly what's occurring and what's going on. So again, you want to mirror me, and you want to pay attention to the directions that I give you so that you're not overexerting yourself or hurting yourself throughout this process. And number 3, you want to breathe. Inhale, exhale. It's really important to breathe because as you breathe, you allow those tendons to elongate as well. So those sarcomeres are going to send signals to you. Those sarcomeres are your muscle fibers stretching or tearing. They're going to send signals to the brain saying, hey, something's wrong, something's not right. You want those sarcomeres to stretch. You want to put them in an uncompromising positions. You want to feel those stretches no matter if it's in your neck or if it's in the muscles that you're utilizing doing other exercises. You want a breakdown and a tear down so that you have mechanical stress, so that you can recover and get stronger and work on those areas that are discomforting to you. However, you don't want to have that pain or that discomfort that is sharp or that doesn't allow you to continue with this routine. If that's occurring, then you need to go see a medical professional. I'm not the medical professional. I'm just directing you through this format so that you can get some relief of that tension. And then we get to 4, rate of perceived exertion. It is a 1 through 3 scale. 1, you're relaxed, you're confident, you're following along with me in that dialogue. You got your cell phone turned up, you got it on YouTube, you're watching me, you're streaming me on Facebook, and you're clicking the double picture so that you can take a picture of me home with you. That's awesome. That's great. I do sign autographs. You just got to send it to my address, and I'll take care of that for you. Number 2 is you are stretching a little farther. You're getting into that static stretch or that active stretch with the neck. You're feeling a little of relief in the neck. If you get to the 3, you're probably not feeling relief. You're starting to sweat probably a little bit more, and it's getting more discomforting. So if you get to the point where you're sweating too much, you're getting discomforting, your heart rate's going up as you're doing these stretches, again, you want to hit that pause button. You want to come back because that means we're doing something wrong. And it's something that you might want to get checked out. So here we go. Let's get started. We're going to review a lot of those cervical maneuvers that we did in the past through the vehicle, and then we're going to add some new ones as well to assist you with obtaining the goal of today, which is take away discomfort and then educate you as well. So that first exercise we're going to do is we're going to just do a neck bend forward, and that neck bend forward is going to be more of a flexion and then an extension as we extend back. So the initial exercise we're going to do is we're going to just really drop that chin to that chest, and then we're going to bring it back to that neutral position. So we're going to do that 5 times through, and you're getting a stretch. You're going to feel it right through here, and then you're coming back to that neutral position. And I'll explain some of those muscles that you're going to feel, some of those muscles that allow you to do this range of motion with this flexion is you have a sterno, and I'm not exactly sure of the rest of the name of that, but it is a sternocleidomastoideo, and I'm not talking about Jorge Masvidal. I'm talking about a sternocleido muscle that is in your neck region, and that actually is behind your ear. So it actually goes behind your ear, and then it comes forward right to the collarbone, and then right into the sternum. So you can actually feel it as you rotate and turn your neck. You actually be able to feel that muscle as you rotate that neck. So as you go forward, you're utilizing that sternocleidomastoideo, and then if you go up, you're utilizing it as well. It's allowing that neck to stay in that position, and it's giving it nice support. So we're taking this all the way up. Now we don't want to go too far back to the point where you lose your language, you lose your ability to speak, because that means you're putting too much pressure on the cervical vertebrae and those cervical nerves. So you want to go just right where you're feeling a little bit of stretch right through here, and those are your muscles right there, the sternocleido muscles, and then you're coming back forward just like this. There you go. So now the next exercise we're going to roll right into through this format is we're going to just do a natural rotation. So we're going to rotate our right ear to the right side. And then you're going to come forward. And then you're going to do it again. And you're just trying to take that chin over the shoulder. As we have two more. And one more. And then go back. So now we're going to go to that left side with this rotation. So most of you don't know, when you get to the C1 and the C2 of your cervical spine, you have your C1 is called your axle, and your C2 is called your axis. A-X-I-S, as we do two more. And it allows you, again, to do motions. The axle sits on the axis, and without the axis, you can't move your head back and forth like this. Not rotation, but moving it around in a circle like this. Without your axle, you can't move your head back and forth, protract, retract, and flex and extend. So you utilize those together to be able to do these exercises that I'm showing you today. So it's really important to maintain the strength in the C1 and the C2. So that was your rotation. So now I'm going to show you another type of rotation, which would be another neck rotation, but it's going to be a circular rotation. So you're going to just go to your right and you're just going to circle around. So this is utilizing your C1 and C2 because it's allowing you to move on the axle and over the axis, and the C1 and C2 are really getting utilized right now. As I come back to that front and that center, and I want to go the opposite direction now. So now I'm going to go to my left and circle to my right. Now this has the potential to get you a little dizzy as you drop that head down. Make sure it stays above the heart, and we're doing two more. So I know that my equilibrium is not as great anymore. I do not like riding on roller coasters. I do not like being in the passenger seat. That's because I'm an alpha and I like driving. But I also get motion sickness as well. So circling is another way to do a rotational exercise. So you don't have to just rotate back and forth, right and left. You can rotate in a circular pattern, which then takes us to that side bend. So the side bend would be taking your right ear and just trying to reach down. And there you are. You're stretching out this muscle that comes down and connects, right? That's that sternocleido muscle that I was talking about that connects to the collarbone and your sternum. So it wraps around that ear, comes around, and just rolls down through right into there. And you're stretching that out. Back up to the top. Let's do that 3 more for the cervical 3. And a nice stretch, and then back up. And now you can, again, maintain this for a static hold. You can hold it for 20 seconds. Or you can do it more actively, like I'm doing it right now and demonstrating in an active manner, because now we're going to go to that left side. And now I'm stretching out around that neck again, around that ear, and it wraps around into my collarbone, into my sternum as I come back through. And I'm going to my left side. And again, it's more of an active stretch. However, you can put it in a static stretch and you can hold this for a length period of time 20 seconds to even 2 minutes. But you have to really be careful as well that you're putting your neck in this position. You want to make sure that you don't have those musculoskeletal changes that do occur over time, which they occur over time. And those are the things that we like to discuss and like to talk about so that you can improve not only your posture, but those musculoskeletal challenges that occur as we age. And I could go in depth of how many of those change and how they look. You know, you've seen that individual that has that thoracic kyphosis and they're bent over and they're walking down the street with a big old hunched back, right? And I could run up to them because they're a creepy old dude and I could tackle them, right? And I tackle them, I could get them back up. I could take a telephone pole, I could take a popsicle stick and I could glue them to their back, and I'm still not going to get them to stand straight upright because they had musculoskeletal changes over a long, lengthy period of time. You can't change that by just doing this periodically. You can't just do this by all of a sudden, hey, one time a week, I want to try to get some stretches into my neck, or I want to try to incorporate strength training into my back, or I want to improve my anterior strength. You're just not going to get that. It doesn't work that way. You have to systematically do these exercises on a regular basis to improve that posture and those musculoskeletal differences. If you don't, and you just throw them out there every once in a while, well, guess what? You're not going to make any type of improvements. In fact, you actually could do more harm, because then all of a sudden you're thinking that you are getting a little more flexible, you're getting a little stronger, and then you try to move through an entire full range of motion, and what happens is you compensate and then hurt other areas, neither be in the neck or the thoracic spine or in your shoulder region, just because you've been doing stretching one day a week with me through the cervical aspect. So I would say do this multiple times and continue to try to improve as we go to that protraction and retraction. So remember, the protraction is pushing that chin out, and then retraction. Protract and retract. So again, you're working that neck region, and you almost could just make those noises like, right? You could, but I'm doing that. You don't have to do that at home because, again, you can hear me. I can't hear you. And again, you're just coming back. So you can do them static, hold it back. You can hold it forward, static. Or you can do a little active and a little dynamic and really try to improve that muscular development. Because, again, 2 reasons why we tend to get neck pain or discomfort, or we lose the musculoskeletal posture as we go through this journey in life, is 1, those back muscles, they get overstretched, or those anterior muscles, they get weakened. Now, you say, how can my back muscles get overstretched? Well, they get overstretched because we start rolling those shoulders forward, and those back muscles can't pull those shoulders back anymore. So then what occurs is those anterior muscles, they get really tight, they get atrophy, they don't get the hypertrophy that we're looking for, and then everything starts sinking and you start leaning forward. So how do you fix that? You got to do isometric exercises. Now, are these isometric exercises? No. Will they help you? Yes. Will I go over the isometric exercises at some point in time? Yes, I will. And that might be in the cervical 4. So let's finish up one more exercise here today. Send you on your way, and then, peace, deuces, and then we'll come back to cervical 4 at some other time. So there you have it. We did a few different exercises for you. We just got done doing protraction, retraction. We did the rotation. We did the 360 rotation, right? Both ways. We did your side bends. We did your flexion and extension. And now we're going to finish off with those shrugs and hit those shoulders. So in that seated position, you're just going to shrug up. There you go. Nice and tall. Nice, good shrug. You're going to hit those upper traps, those mid traps, and those lower traps. Now you might be at home saying, Jesse, what sequence do I go through? in cervical 3 to get the best effect. There is no sequence. The sequence is wake up and do these exercises each and every day to try to reverse those musculoskeletal challenges that you're having, any pain, any discomfort, any tone, any tightness. And if you do that on a regular basis and not just periodically or once a week and think to myself, hey, I'm exercising. No, you're not. You need to do it on a regular basis. Just like I put these videos out on a regular basis, you need to exercise with me on a regular basis. So hopefully you enjoyed this cervical 3. I was your host, Jesse Swear, and hopefully I educated you a little bit more with that sternocleidomastoideo. Just don't hit Kobe Covington in the mouth and break a tooth or ruin a Rolex. Peace, my friends. Have a great day.